Hey everybody, welcome to Muscle Maven Radio. I'm your host, Ashleigh, the Muscle Maven Van Houten. Thank you so much for being here. I appreciate you joining. I know that I've been not quite on the ball with getting podcasts out every Tuesday. I am, a little busy these days with a baby who takes up a lot of time. No excuses, though. I appreciate you guys sticking around, staying subscribed, listening to the podcast. Still got plenty of great guests, just maybe not as 100% reliable on the output as I normally am, but I'm working on it. Today's episode is with a guest that you guys, listeners, have been telling me to have on for a very long time. So this is a long time overdue, and I'm very, very glad I was able to get her on the show. Her name is Dr. Carrie Jones. She's a functional women's health and hormone doctor. She believes in the importance of understanding our hormones in a way that is actually accessible and useful, because they can be very complicated and overwhelming, and we know this. And I have to say, we talk about a lot of stuff in this episode. We talk about testing for hormones. We talk about the cyclical nature of hormonal health and what our hormones are doing in our bodies. But she really does explain a lot of these things in ways that it really clicked more for me than it has in the past. And I've talked to a lot of people about hormonal health. I've done a fair bit of research, especially cortisol. We talk about cortisol, what it does in the body, and how it impacts the other hormones. This is relevant for men and women. And she just really articulated it in a way that stuck with me really, really well, really clearly. So I hope that you find that to be the case as well. She's fantastic. She's a great follow on Instagram. I'll put all of her information in the show notes. But that's it. I'm not going to waste any more time. I'm just going to dive right into this episode with Dr. Carrie Jones. She is fantastic. We can never know too much about our hormonal health, so very useful. Please do share this episode with anybody you think could use it, which I think is pretty much everybody. We've all got questions about hormones, but sharing it, passing it on, rating, reviewing, subscribing, that's what keeps this podcast going. So I appreciate you in advance for helping me out. All right. Enjoy the podcast with Dr. Carrie Jones. All right, Dr. Jones, thank you so much for being here.
Oh my gosh, thank you so much for having me. This is a long interview in the making, so I'm excited.
It is actually, and you are somebody who I have been told time and time again that I need to have on the podcast. So I appreciate you taking the time. I've been a fan and a follower for a long time, but it's awesome to actually have you on here so I can pick your brain. I'm very excited.
Yes.
So before we kind of dive into it, just quickly, tell all of the listeners sort of like what you're up to these days, how you're doing, just what's going on in life generally.
I tell people I'm up to my eyeballs in hormones. That's what I do.
Me too.
That's what I'm in. Right. And it's the end of the year and there's been a lot of stress going on. So I'm up to my eyeballs and a lot of very stressed out people having a lot of hormone symptoms. And so, I'm excited to talk and talk this through. Yeah,
it seems like it is. I mean, a topic that certainly never goes away because it is kind of ever evolving for women, especially, right? Like certainly it's the case for men as well. But I think with women, like it really is more complicated for us. We do have so many more, I feel like discrete stages of life. If we're talking about like reproductive and then pre and peri and post menopause, all of these things, there's just so many more things happening. And I feel like in my very limited experience of kind of researching and trying to learn about this stuff, it does seem like a lot of it generally is painted with like a very negative brush that doesn't have to be necessarily like certainly there are challenges, but it just feels like it's always negative. It's like, here we go, another thing, and this is inevitable. And this is what being a woman is. And I guess
it's not fair.
Yes.
Right. It's not fair. And I hate, it's like the hormone, like as an example, the hormone estrogen. The hormone estrogen gets vilified all the time. It's like, oh my gosh, it's my estrogen. My estrogen causes my PMS. My estrogen is why I have fibroids. My estrogen makes my endo worse. And while estrogen out of whack can absolutely do that, on the flip side, estrogen is what's helping protect our heart, protect our brain, and protect our joints and, protect our bones and our mood and all this stuff. And so we have to think of hormones as like the body really does want them to work for us. The body really does want our hormones to help us out. I mean, they're there for a reason. They're ultimately supposed to help us. But they can get off track. Can be like a roller coaster off track. And then that's when we get these symptoms. And so I completely agree with you. I think just the act of being female gets painted as like, it's a giant pain in the ass because you have to deal with these hormones. And I'm like, hold on.
Some of it's good news. Some of it can be good. Yeah.
Yeah.
Okay. So this is kind of a very general question, but I feel like it'll help start to like hone in on some specific ones. Cause I reached out to like my community on social media and I got a ton of questions. We will not be able to get through them all, but I'll try to like organize them as best I can. But the first question I have is, and I know you talk about this a lot, that there are a lot of lifestyle factors that you can do and change and adjust to help with your health and your hormonal health. And a lot of those lifestyle factors tend to be the same things we hear over and over again to fix everything, right? Like improving your health and your stress and your food and all these things. But are there some signs that individuals can pay attention to when their body is telling them that they need more than just what they can do? Like they may need to start talking to a professional about hormone replacement therapy or just other methods that like the lifestyle factors just aren't cutting it. Like how can you tell?
So I actually got this comment in Instagram the other day. I was talking about estrogen detoxification and she said, I eat healthy. I take care of myself. I exercise. I sleep. I feel like I have good boundaries and I still feel like crap. Like, what else can I do? I said, I think like A for effort, good for you. You've covered all the fundamentals that, as you feel at this point, it sounds like you probably should either get real lab testing, like you should see a professional, you should see extra help and see either what you're missing, or maybe you're doing all these things, but it's this thing over here that you just didn't even think about, that's causing your symptoms. So what I tell everyone is if it's interfering with your life, right? If it's affecting big time the way that you do things, think about like bleeding. Like when you get your period, how many women are like, oh my gosh, I bleed through so many tampons. I bleed through I have my underwear, period underwear. I have to get up in the middle of the night. I have to wear a tampon and a pad when I go to bed. I bleed so heavy. I'm like, hold on. That might not be normal. Because no one told you that might not be normal. And like, how many days do you do this? Oh, this at least 4 or 5 days. Hold on. That's definitely not normal. And so I wish even just establishing baseline normal in the female body was more advocated for, because we just assume sometimes, well, this is how I've been my whole life. Yeah. I've always had severe 10 out of 10 cramps. It's part of being a woman. Like, no, it's not. No, it's not. 10 out of 10. No.
Yeah.
Sure. If you're at like a 2 or a 3 or a 4 sometimes, and then it gets way, better, fine. Let's work on that. But at 10 out of 10, that's debilitating. That's going to interfere with your life. And so some of these things I really want women to think about, like, oh, you know what? That symptom, whatever it is, really does interfere with my life. I am doing all the things I think I'm supposed to do.
Yeah.
And it's not improving. It's not getting better. And in fact, in some cases, it may be getting worse. And that's when I'm like, seek help, find somebody who's knowledgeable, maybe get some testing. You might need supplementation or hormones or whatever it is.
Yeah.
To help with these things.
Yeah. And I think that's why it's so important that there are people like you out there who are providing information like that's so accessible, because one of the things like in the last year, I was pregnant and had a baby. And so I like started researching in a whole new area of women's health. Yeah. Right. And I just keep coming up against what you're saying, where it's like so much of what's negative or scary about these phases of life is considered inevitable, or we're told it's inevitable. And also that we aren't necessarily taught to or encouraged to even just ask questions and advocate about it. Because even if it is normal, for example, we don't know if we don't even ask the question, like, I'm suffering with XYZ. Like, is this normal? Is this okay? Is there anything I can be doing? We just don't even think a lot of times. A lot of people, like I have talked to so many friends. I don't want to go down too much of a tangent right now, but so many friends about pelvic health, like, and that kind of thing. And people who are like very sort of educated, knowledgeable about their body, generally speaking. And like, they just didn't know that you could go to a pelvic health therapist, or that you could treat your core and your pelvic floor after birth. Like, no idea. And so they're just
nobody told them.
I'm just going to pee a little bit forever. I'm just going to feel a little bit uncomfortable forever. Nobody had any idea. So I think that anyway, all that to say, I'm grateful that there are people like you who are putting this information.
I love that you said ask questions. I just love that you said ask questions, because so many women, it's like, say it runs in the family. You're like, mom had 10 out of 10 cramps, bled heavily, like aunts did it, your older sister did it. And so you're like, well, it's just, that's just was dealt to me. It's normalized in the family. And then you talk to me, to some other provider, and they're like, that's actually not considered, healthy or normal, common, but not normal. Like, let's work on this. Yeah. And so I love that you ask questions. If you are concerned about symptoms you have, it's interfering with your life, you really are questioning if it should be normal, as opposed to common, start to ask like, hey, I'm having these symptoms. What would you consider that? Would you consider that excessive?
Mm-hmm. And what's the worst that could happen? People are like,
yeah,
I don't know. They're like scared that people will be mad at them if they ask a question or think that they're stupid. It's like, I'd rather ask the question. And even if it is a stupid question, I'd rather ask it than not ask it and not get the information. Right. So,
right.
Speaking of testing, so I see the Dutch testing behind you, and I know that that's a big part of this. And I will confess, I have a Dutch test in my bathroom that I have not used because, like, honestly, I know it's terrible. I just have been so lazy because it's like the timing. You got to like do it at the right time of the month and stuff. And anyway, and now like I got to wait until things even out with everything. But
post baby.
Yes. Would you recommend, generally speaking, for most people who, again, are listening to this podcast and have questions like so many people did when they were sending them to me on Instagram, is that a good baseline, first line of defense testing? Like just across the board, just take a Dutch test. It'll give you so much information. Is that accurate?
So the answer is yes. It is a great baseline test. It is an at-home test. It's really easy to collect and do. It's not a blood draw, which is great for a lot of people. But I will caveat that by saying that it is billable to insurance, or you can like run it through an FSA, but it's not considered like a standard insurance covered test. So from a budget point of view, if somebody says, I feel hormonal, I really want my hormones checked, but my budget is not going to allow it, then maybe you're going to be looking at blood work. So you're going to maybe get a hormonal blood work screening instead. Not nearly as comprehensive, I'll be honest, if they're just looking at, typical hormones like estrogen, testosterone, progesterone. But it's a good start. You got to start somewhere. And so I want to take that into consideration. But otherwise, it's a fantastic test. It's 6 pages of comprehensive hormonal information, all about you.
What about though the idea that I guess, so you take it different times of the month. And so it's giving you like a more...
You take it one time. Yeah. So you take it, for a cycling woman, you generally test 5 to 7 days after ovulation, which is generally days 19, 20, or 21 of a 28-day cycle. So I get my period every 28 days, roughly day 19, 20, 21. Pick a day. I will do the Dutch test. If you're menopausal, you can pick or male, you can do it anytime because you're not cycling. Then it's different. And so, we are specific on the day you take the test.
Okay. And is there any issue with it could be different from month to month, depending on, like if you're stressed out, if you're traveling, if something's going on?
100%.
So then how good can we feel about the information if it could change from month to month?
So the information is any blood test, saliva test, urine test, any test you get is only accurate to you in that moment. That's it. Right. So if you have a great month and you do a blood test, a saliva test, a urine test, it doesn't matter. And you get your results back, that's what you look like that month. But if next month you're traveling, you're skipping time zones, you're stressed out, you're burning the candle at both ends, you haven't been sleeping that great, you've been having too much wine, then you do your hormones again, they could look totally different, but they're accurate to you at that time as a stressed out, not sleeping mess. Mm-hmm. So that's what I want people to go like, I don't know that it's accurate because they change all the time. It's accurate to you in the moment.
And that matters. That's still important information. Yeah.
Super important. And most people have like a low grade, like it's when we talk about stress, like when they say, well, my stress changes. I'm like, well, is your stress rating about the same? So the actual stress itself might be different, but is your rating about the same? Like, would you rate yourself on average stressed out 5 out of 10 most days of the week? And if they're like, that's about right. And it doesn't matter if it's the kids, it doesn't matter if it's work, it doesn't matter if it's bills, it doesn't matter if it's the news, that may shift what's causing them to be stressed out. They're like, I'm about a 5 out of 10. Cool. So when you test, your cortisol is going to register the fact that you always kind of run at a 5 out of 10. And it's going to give you pretty accurate feedback on the day to day because you always kind of look like that. But when you're looking at female hormones, estrogen, progesterone, we want to be very specific on the day of the month you test because your menstrual cycle is a very choreographed roller coaster. So we want to pick the right point in the roller coaster that you're going to hit.
Yeah. It's an interesting concept to talk about, like, physical stress versus like how you are thinking about the stress. Like, and it's something that was interesting to me when I was like training a lot and doing like bodybuilding and stuff, which is obviously a very physically stressful thing, but I wasn't necessarily registering it as stress because I enjoyed it. Right. But that can be a problematic thing. And I feel like, especially for women who are always trying to do it all and do everything for everybody. And a lot of times they find their stress relief in like these overly intense, maybe workouts or just like grinding away in the gym or cardio or whatever. And that thing that is like topping up their stress bucket that could be really negatively impacting their hormones is also the thing that they think of as helping them de-stress. So how do we manage that? Like, cause I have a hard time. I do some coaching and some work with women one-on-one. And this is one of the biggest things is that it's like, they feel like the more stressed they are, the more they need to double down on like busting their ass in the gym. So how do we do that?
Instead, we're like, I want you to double down on sleep. And I want you to double down.
No, I don't want to.
And reading. I want you to like casually walk around your neighborhood. Casually. Don't speed walk. I know it's a hard mindset to get into because social media, I had a woman write me and she said, I'm trying to get pregnant. My cycles are irregular and I spin cycle twice a day. Do you think the twice a day hour long, so 2 hours a day of cycling is a problem? And I was like, yep, sure is. As a matter of fact, it sure is. Because what happens is when you are stressed, when you have stress, your body's only thought is to protect you.
Yeah.
You subconsciously, your brain is like, protect. We need to protect you. Be hypervigilant. Let's work through this, protect. And so it thinks a tiger is in front of you. Whether a tiger is in front of you or not, doesn't matter. That's the cascade that happens in your body. She's stressed, tiger. Let's run. Let's give her energy. Let's give her glucose. Let's prepare her. So then you go and get on a bike, or you go and get on a treadmill, or you go for a run outside, or you go and get on the elliptical and you go hard for 30 to 60 minutes. Your brain doesn't know the difference between we're exercising for stress release and she's now running from said tiger.
Yeah.
Like she's turned around and started running from the tiger. If you're running outside, your body's like, well, she's running. Clearly there must be a threat, a bear, something. So when you're in that already hyper stressed out state, that's the problem. When you are baseline, pretty normal, your ability to bounce back is healthy, then exercise is a good stress. We want to push the system and then have recover days so we can truly recover. But when we're maxed out, most of us know when we feel maxed out, then that all out exercise actually is detrimental.
Yeah.
The all out cardio, the all out weightlifting, the HIIT, it's just too much. And so I'm asking, I know it's a hard mindset for women and I'm having them flip. I'm like, just like you, I'm like, hey, look, I need you to do less all out, less cardio. I need you to think about restorative and resting in the exercise department.
It's funny though, how like, obviously that woman, there's a part of her brain that knew because she was asking you the question. She already knew the answer. She wouldn't ask the question that way. Right. She just wanted somebody smart to be like, yeah, you're right. Yeah. It's very tough. And I think teaching people to, and having them really internalize that it is the recovery time that you're actually getting stronger. It's not when you're in the gym beasting yourself. That's when you're actually breaking your body down. And so the recovery part is at least, if not more crucial than the breaking yourself down part, because you won't get stronger if you don't let yourself rest and recover. I just think people have a really hard time with it. But can you try for us to break down, because I've had some questions about cortisol, obviously, and how it's a very important, it's a hormone, right? It's a very important hormone but it can do some bad things too if, it goes haywire. So can you talk about how, in like a case similar to what we're talking about, how cortisol actually acts on or with or against the other hormones? Like what's happening to our estrogen or testosterone, all of these things when cortisol is too high all the time?
Yeah. So cortisol is made from our adrenal glands. It's part of our hypothalamic pituitary adrenal, or HPA axis. And we need cortisol to survive. If you don't have cortisol, you unfortunately will die. Cortisol's main job in the stress response, the very first thing that it does is help with blood sugar glucose creation. So if it had a resume, if it had a CV, it would say that I increase glucose in your body. And the reason is you're stressed and the brain needs more glucose to think this through, to handle the stress. Your skeletal muscles need more glucose to fight, to run, to punch, to kick. Most of our stress is not physical, though. Most of our stress in our life is a mental, emotional, or physical, but maybe from like a bacteria or a virus or inflammation standpoint. We're not actually fighting bears or running away from woolly mammoths in our life. So cortisol is supposed to go up in the morning. It goes to a nice peak. It's called the cortisol awakening response. It does this within the first 30 minutes of you waking. It's to get your booty out of bed. It's to give you some energy. It's to give you some glucose because you've just been fasting overnight. It's to reduce any inflammation you have. And then once it hits that peak, it gradually falls until it's nice and low before that you go to bed. And you want it low before bed because you need to go to sleep. It's hard to go to sleep when your cortisol is high. So that's the rhythm of cortisol. Now, how does cortisol, like high cortisol, affect your hormones? Remember, I said your brain really is just trying to protect you. That's all it wants to do. And especially important in females because the brain knows if it's in a depleted state or feeling threatened or highly stressed out, then it's going to need to shift the way that you do or don't potentially get pregnant that month. Now, it doesn't matter if you want to get pregnant. I don't want to get pregnant, but I know that when I'm stressed out and not sleeping or traveling time zones, my period is going to be different because my brain is trying to protect me. So what happens is the cortisol goes to the brain with high levels of cortisol. It rushes the brain and the brain goes, that's a lot of cortisol. Like, yike. So it starts to suppress the signal in your ovaries to make progesterone, usually first, and then estrogen second. So what happens is your ability to push out an egg or ovulate goes down. Your ability to make progesterone goes down. This is important because progesterone is our calming, soothing, relaxing, everything's going to be okay hormone. It's our progestation hormone. It helps us not have PMS. It makes our periods easier. And now we've just lost it. And then if we continue with this stress, what can happen with some women is their estrogen will also go down and they will lose their period or their period will be late. A lot of women said in the height of the pandemic, I skipped my period. I skipped this month, I'm 2 weeks late. I'm not pregnant. What's going on? Everything's wonky. I'm like, right, because your cortisol is screaming at the brain, protect, 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 and don't have a baby. Maybe now is not the time. Now, obviously, there are women who got pregnant in the pandemic. Their brain was thinking different. Their stress was different. Everybody's different. But a lot of feedback to me in the DMs was, what's wrong with my period? And that's how cortisol affects these hormones from the brain down because the brain's trying to protect us.
Okay. That is very helpful way of putting it. Actually, I think it's gonna stick with me better, I think. And the way you describe progesterone too is actually very helpful. And now I kind of want to talk about that because that sounds like a hormone that we want to have lots of.
Yes.
Right. And also I feel like there's a lot of talk about having like too much, like estrogen's too high or something. But then I hear people say, but really maybe it's just that your progesterone's too low. So it's not, or it could be both. I mean, here we go again to how complicated this stuff can get. But what are some things we can do to like keep our progesterone nice and high? And should we always want it to be nice and high, or should that also kind of be cyclical?
It is cyclical. So like I said, it is a very choreographed roller coaster that we go on. So our estrogen goes up on the roller coaster in the beginning. So we get our period. That stage is called our follicular phase. And then gradually our estrogen goes up the roller coaster. Once it hits at the top of the roller coaster, the next act is that we ovulate, we release the egg. So estrogen helps tell the brain to tell a different hormone, release the egg. Estrogen comes down the roller coaster. Now we're in what's called the second half of our cycle, or the luteal phase. And now progesterone comes up the roller coaster high. Estrogen comes up, but not as high. So it's the difference between like a mountain and a molehill when we're looking at progesterone and estrogen. So progesterone's only out in the second half of our cycle. It is not out in the first part of our cycle.
Okay.
If it's flipped, if for some reason estrogen's winning in the second half, estrogen rides that roller coaster higher than progesterone. Maybe progesterone's flatlined. didn't come out at all. That's when we get those really what we call, I feel hormonal. I feel PMS. I feel heavy periods. I feel like my fibroids are growing. I get migraines because of the shift in estrogen and progesterone. So when I said, we already talked about stress, stress is definitely one of the biggest things that affects the way that we do or that we don't ovulate and that we do or don't make progesterone. So we can never get rid of stress. I am not saying you have to go be Zen-like in a tropical island. I mean, do it if you want to, but it's not right. But like how you manage stress, how you set boundaries, how you take care of yourself, ultimately from all areas, your mental, emotional, your dietary, your lifestyle, chemicals, right? Toxicants you're exposed to, the relationships you're in, the fulfillment you get in your family or your job or don't. All of these play a big role in how you make progesterone and estrogen. But again, this roller coaster is very, like I said, it's choreographed. It's set in stone. It's a rhythm. And to set our rhythms, our master rhythm is how we go to bed at night and how we get up in the morning. So then it goes back to sleep. At night, do you sleep in darkness? Darkness helps to reset our rhythm. In the morning, do you get light exposure, full spectrum light exposure? Do you go outside? Do you walk your dog? Do you do exercise outside? Open windows? Do you have a full spectrum light box? Because and I don't mean phone, I mean the full spectrum light as if you were getting a little sun exposure in the morning on waking helps to set a rhythm. So we use light and dark to our advantage. And how many people through the whole pandemic weren't sleeping? They were up late watching Netflix. They were into all the murder mystery stuff. They were learning about Tiger King, right? Like they wanted like all the things. They were watching every single episode of everything that they could find because suddenly everybody worked from home and they could be up till midnight or 1 a.m. because they didn't have to drive to work. So they were throwing off their sleep schedule or they were anxious, hypervigilant, concerned, scared. And then when you throw off your rhythm, your master rhythm, you throw off all the other rhythms, which includes your menstrual cycle rhythm. So it all ties in. Nothing is independent in the body. Everybody is talking to each other all the time. So when I'm asked how do I keep my progesterone high? We have to figure out why is it getting messed up in the first place? What's screwing up its rhythm, right? Like what's going on with your stress, your sleep, your diet, your lifestyle, all the things.
So it's really less about do this particular thing to keep your progesterone high versus like, let's sort out your life and how your body's working. So it just does what it's supposed to do.
That's always first. That's always the foundation. Are there supplements that could maybe support progesterone? Sure. Can you take actual progesterone, the hormone? Of course you can. Did that solve any root causes? Nope. Sure didn't. Because what if your reason for low progesterone is actually a thyroid issue? What if it's you have a gut infection? What if it's you hate your job and your stress is through the roof? You're not sleeping at night and you're just taking progesterone and you're like, I hate this. I have to take this forever. This stuff, it's just a Band-Aid. I know it's just a Band-Aid. You have to go back and address the foundation, but we have to figure out what the foundation is for you first.
Yeah. It sounds like that's another example of, you were mentioning before things that are common, but not normal because I mean, a lot of women, nearly almost every woman, I would say, does or has in the past had cycles or periods where they get headaches or migraines. They have really bad PMS. It's way more painful than they think it should be and all of those things. And a lot of times, as you're saying, it could be pointing towards maybe higher estrogen or lower progesterone and the system being kind of off. So that seems to be sort of like a pretty significant thing that women as a whole are going to want to be sorting out generally in their life.
Yeah. And we're not taught it, right? Like this is not things we are taught in middle school or high school or at any point. And so a lot of women are learning it for the first time as full grown adults. And a lot, even still, like a lot of women just don't know. I mean, like I have fully, adult women with children who are like, so I've managed to have children, didn't know how my body worked. Like, not really sure how I got myself pregnant. Didn't know this about the menstrual cycle. Didn't know this about progesterone. Didn't know. I don't know what perimenopause is. I didn't know that women go through a transition as they get into their 40s and 50s. Nobody told me. I'm like, it's a disservice. Yes.
So if high estrogen in the latter part of your cycle is an issue, you've talked a lot on social media about estrogen detoxing.
Detox.
Let's talk about that because that's another thing that maybe I feel like has been incorrectly sold to us, where like you can't detox things, your body detoxes things naturally. You don't need to make any extra effort. But of course, that's not always the case. Sometimes we do need some extra help. So
yeah. And you're right. Thank goodness we have these, what we call them emunctories, the fancy word for their organs of eliminations. We breathe, right? We breathe out toxins. We sweat out toxins. We pee out toxins. We poop out toxins. Our liver processes to handle pretty much everything we eat, breathe, drink, and swallow goes through the liver so the liver can deal with it and then figure out how to get rid of it. So we do have an innate detoxification system, which is fantastic. The problem is, though, as we know, how many people listening have ever been hungover? How many people have ever been hungover, right? So, if you drink too much alcohol, that's going to get into the liver and it's going to cause a lot of problems. Being hungover is one of them. It's going to affect the way you detox. So if you're routinely having alcohol every night because it's your stress relief, it's going to affect how you detox in general, including your estrogen. If you are deficient in certain minerals required for detoxification, for example, if you're deficient in iron, let's say you're iron anemic, you need iron for the first step of estrogen or all detoxification, honestly, not just estrogen. So many women are iron deficient and they're going to struggle with that first phase. The second phase is required of magnesium. A lot of people are magnesium deficient. We don't get it, or we don't absorb it very well. It's hard for us to keep in our body. We have a big magnesium need as humans. And so just these little things, I see the arguments online where other healthcare practitioners scoff at the need to support detox more. And I'm like, except when you follow basic physiology and she's missing, depleted in, deficient in certain nutrients, or she's doing things, alcohol, Tylenol, which is acetaminophen, medications that are hard on the liver, that's going to affect the way that we do or don't detoxify. Yeah. And there are more. I'm just listing, a few examples. Yeah. And so it's been really astounding to me when I explain this, and then, people and the genetics, we haven't even touched on genetics. Like, what if genetically you are slow in certain ways that you process chemicals or process hormones, then it doesn't matter that you have a liver. Like, genetically, you're slow. And so we can work to support that. And so, like I said, when people scoff at that, I'm like, no, like, it's true. We have livers and kidneys and, sweat glands, and thank gosh we have them. But at the same time, like, we can clean them up. Like, we can do things to like help support them as best that we can. And we just live in a toxic environment. I mean, I think people are pretty aware, like our air we breathe and the water we drink and the food we eat is just not as clean as it used to be. The chemicals, the things people put on their skin and they on their hair, and what they use to clean their house with, and all the fragranced plugins everywhere. Like, your liver has to process all of that. Yeah. And estrogen too, by the way. So which do you think is going to get priority?
Yeah.
It's not estrogen.
Yeah. It's like the toxic load situation. It's like if we were living in a perfect world where nothing around us was toxic and we never drank booze or ate crappy food and our bodies were working perfectly, we could just let our own innate systems take care of it. But sometimes we need more help because we don't live in that world, and pretty much nobody does. Right. So what are some things that we can be doing? I mean, obviously reducing the toxic load, right? Like by picking less toxic products and things like that. Is there anything else?
So, alcohol, working on reducing alcohol. And again, I'm not saying, people go, oh, are you like anti-alcohol? I'm like, no, be aware if you have bad PMS, if you have all this sort of hormonal symptoms and you're listening to this with your second glass of wine in your hand, maybe it's possible you need to cut back on that. And I mentioned nutrients, things like iron. So don't just take iron, double check to see if you actually need it. But there are other nutrients like magnesium and zinc and choline, which is like what's in eggs. A lot of B vitamins, tons of B vitamins are involved in the way that you detoxify. The chemicals that you mentioned. So there's definitely a lot that we can do to support the way that our liver functions. I do want to say though, with detoxification, I will get asked, Carrie, I want to do a 3-day or a 5-day or 7-day, like an estrogen cleanse. Can I cleanse out my estrogen? I'm like, nope. You make estrogen 24/7, 365, which means you have to detoxify estrogen and all your other hormones 24/7, 365. So whatever you're doing, don't just think you can do on a 2-day juice cleanse weekend, and like poof, come out Monday that you fixed the problem. You haven't, because it's every single day. These hormones are made every single day, and you need to be aware of it every single day. Do these quote unquote, doctor approved cleanses help? Sure, they can get the ball rolling, but don't do it over a weekend and then go right back to your old lifestyle on Monday. Like you're right back to where you were.
Yeah. Yeah. That's about as effective as an actual juice cleanse, which is to say not effective. Yeah. And I know we're talking about women's health and women's hormones here, but like most of this advice would be the same for men too, wouldn't it? Yeah. I mean, it's nutritionally and like getting rid of this toxic, it's all the same.
100%. Yep. Yeah. And when we look at detoxification pathways, it's the same in men as well. They need magnesium, they need B vitamins. They can't be depleted in iron. They have to watch out for their chemicals as well. They need to focus on their sleep. Absolutely.
Yeah. I would say too, a lot of the nutrients that you're talking about can be found in a food that I like to promote. I wrote a book about it, about organ meats like liver and very nutrient dense foods, right? I mean, everything that you just mentioned is in these. Getting people to drink less booze and eat more liver might be a bit of a tough sell, but I mean,
that's not very sexy.
It's not sexy, but I mean, it can be effective. Okay, I have another very kind of specific detox-y kind of question, because there's a blog post on your website, and I'm like a big skincare buff too. I feel like it's just a very fun, like relatively accessible way to take care of yourself, is to get these like non-toxic, beautiful skincare products that like, it's just like this self-care thing at night. It feels good, whatever. And there was I think you had a blog post about like lymphatic drainage and like dry brushing and stuff.
Yeah, dry brushing.
For whatever reason, I don't know why, I feel like I'm very cynical. I'm like, how could that be doing anything? How can like brushing my skin be doing anything? Can you tell me how? Is it really effective? Like, is it doing something?
It is doing something. It's the same. So it's similar to like rebounding, on a rebounding, like a mini trampoline, but for rebounding. So your lymphatic system doesn't work on a pump system. Your arteries work on a pump system. When your heart squeezes, then all the blood gets pumped through the rest of your body, down all the way down your capillaries. Your lymphatic system does not. Your lymphatic system relies on your muscle contraction to squish all the stuff in your lymphatic system into different lymph glands. So lymph nodes. So we have lymph nodes in our throat, right? We have them in our armpits. We have a whole bunch in our abdominal area and our pelvic and groin area. And then it eventually comes around to the heart. And so that your body can work to get rid of it. So they're very superficial as well. They're not necessarily, deep hidden in cavities inside the body. And so they are very affected by when you rebound. So bouncing on a mini trampoline is an example. Using the down up gravity aspect of it can be helpful at moving the lymphatics. The dry skin brushing, when it's done, you're essentially brushing over the lymphatics. Because remember, I said they're pretty superficial and they don't work on a pump system. So as you're doing the light, dry skin brushing over it, you are actually physically helping to move all the crap that's in your lymphatic system into a lymph node so it can get processed, which is why when you dry skin brush, there are, versus just going at it randomly, like just sort of like brushing your body, there's actually a method to the madness so that you can get the most out of it.
Right.
So yeah, it can definitely be helpful. Now, and then you want to sweat, because like how do you, with the sweat glands, right? That you wanted with what's in the lymphatics, you want to make sure that you're sweating. So considering things like sauna or exercise, you want to make sure that you're urinating regularly. So you're hydrated. You want to make sure that you poop every day so that the intestines are working, because this is how we get rid of sort of the trash that's been dumped into the lymphatic system. Okay. So it can be helpful. Okay. It can be helpful.
All right. I'll bring out the dry brush again, because I bought one and I did it and I was doing it. And it's like, I guess you're mostly moving it like towards your heart or towards like your armpits, your groin, like towards those big lymph nodes, whatever. But I guess I just felt like this is too simple to be doing anything good, but maybe not.
And if you're relatively healthy, and this is, I get this feedback, you may not notice anything. It's generally the people who are, maybe much more gunked up, clogged up. Like they tend to say, oh my gosh, I started dry skin brushing and I really noticed a difference. My skin got better. Like this got better. I smelled for a while, but then that got better as things were moving around. And I was like, yeah, I bet you had a lot of sludge, so to speak, right? Trash to get out of the system. And now you're circulating it in a much better manner.
Yeah.
Yeah.
Okay.
But you exercise regularly, right? Like you do all the things. So your lymph probably potentially is moving the way that it should already. So you may not notice anything.
Yeah, that's interesting. And what about the sauna thing? Is that something that you do pretty regularly?
So this is a great question. I'm beyond excited to answer this. In this house, I don't have a sauna. I really wanted one of those really beautiful wood glass spa looking like saunas, right? The house that I live in is not set up for me to have a sauna anywhere. It's very sad. And then I learned about the space looking kind, where you, the portable ones, and they're silver and like your little hands and your head stick out.
Yeah.
And so I just bought one and it'll be here next week.
That's exciting.
I mean, I've known about them. I didn't know about the effectiveness. I ultimately wanted like a real sauna, a spa-like type of sauna. So I was debating, we were debating staying in this house. So I'm like, well, if I'm moving, then wherever I move, I'll probably just buy an actual wood glass infrared sauna. We're not moving. So I thought, all right, there's some cool, Cyber Monday, Black Friday type deals going on. So I went ahead and bought what I think is a really good sauna based on research and colleagues. And so I will let you know next time we talk how my sauna is going.
Is it an infrared one or no?
It is. Yeah.
Okay, cool. Yeah. I'm interested in those little portable ones because I actually have a small 1-person infrared sauna, like the little wood, glass door. Yeah. And I bought that years ago when I was, very gung ho about trying every single thing that I could to and also because I live most of the time in Canada and it's cold here where I live half of the year. And the morale boost that I get from sitting in there and being warm and sweaty just for like 45 minutes a night, a couple times a week, that's even better than I think the other health benefits for me because it can get sad, in the winter here. So it's very helpful. Yeah. But do you know much about, or do you have any kind of feelings about the difference between like a regular sauna, you just go in and it's hot and sweaty versus an infrared in terms of like the detox part of it?
So unfortunately, I don't have the knowledge to say with much authority the difference between, and there obviously like people go into like wet saunas, right? Maybe their gym has a wet sauna or their massage therapy place has a wet sauna. And so they go in and they sweat like crazy, but it's different than an infrared. My understanding, of course, is that there is some difference using infrared light and the way that it mobilizes toxins as opposed to just going in something somewhere hot even on a hot day, you sweat on a hot day. Like people ask me, I sweat on a hot day. Does that mean I'm mobilizing toxins? Maybe, but probably not deep, like a true sauna does that can get you up to Fahrenheit, 160, 150, something like that. And so, that I don't know yet, but once I get this sauna, I better believe I'm going to know a lot more about it.
Nice. Yeah. We'll watch for the social media posts when you get in one of those things.
When I'm in my little space age.
Yeah. That's very cool. Okay. So I don't want to keep you too much longer, but I do have a couple more questions about, and one of them is kind of selfish because it's a place in life that I'm in right now, which is like early postpartum. But people were asking a lot of questions about, first of all, specific symptoms that they're having postpartum, but also just hormonal support postpartum. Things like they're experiencing like, the hair loss that's happening, but like it's maybe they feel like it's more or it's not stopping. Things like, gum pain and stuff like that. Just mood, like all of the things that people tell you. Again, it's inevitable. You're going to have a baby. Yeah. All these hormones are going to go nuts. You're going to kind of feel like crap and be stressed out and you're not sleeping. Right. So is there anything in particular for women who are maybe in that like 4th trimester or like really sort of in the thick of it after having a baby that they can do to support their hormones?
Actually, Dr. Jolene Brighton wrote a whole book called The 4th Trimester. So I do recommend that people at least read that because they can understand better as it relates to what they're going through and their hormones. One of the things I get asked a lot is, can I test? Can I test in the 4th trimester? Can I see what my hormones are doing? Just keep in mind, and not everybody breastfeeds, but if you're breastfeeding, the act of breastfeeding, how often you breastfeed, and then how far away from birth you are does play a role in your hormones. So breastfeeding increases the hormone prolactin, of course, prolactation to give you milk, but prolactin plays a big role in suppressing your hormones, estrogen and progesterone. So you can test. Women ask, can I test? I feel like I'm going crazy, but be aware where you test may be different the next week or in a month based on how much you do or don't breastfeed. So what I do suggest for women though, is to look at things like their thyroid, their cortisol, their iron, their B vitamins, look at all of those like surrounding nourishing hormones and nutrients and see if anything has shifted since you've given birth. Has your thyroid changed since you've given birth? Has your vitamin D level gone down since you've given birth? Are you B12 deficient now? Is your cortisol, which usually is a yes, is struggling because you are raising a human and not sleeping as a result. And so that's where when it comes to testing, that's where I say, estrogen and progesterone, I don't always recommend it, but all the other stuff, yeah, absolutely. Request it, ask for it. Absolutely. Advocate for yourself. And if your practitioner's like, no, you just had a baby, find a new practitioner. There's lots of them out there who's going to advocate for helping you with that. Yeah. Now, as far as what to take, like what can women take, or what do we do? We have to be very careful because it all goes through the breast milk. So if you're breastfeeding, it is much different than if you are not breastfeeding for whatever reason. Not breastfeeding, then sure, you can take lots of stuff to support hormonal, mental, energy, well-being. If you are breastfeeding, then it's much more limited in what you can do. But the hair blowout is real. It's really a bad design flaw. I don't know who thought of that, but yeah, oh my gosh. And it can last a while. It can last all through breastfeeding because hair growth is not the priority. Hair in in males too, hair in humans is not a priority. It doesn't actually keep us warm like on dogs, cats, bears, right? And so the body will shift. Oh, you just had a baby. And if you're breastfeeding, we're trying to create milk, and it's taking a lot of our toll, effort, energy, nutrients are going literally down one pathway, just one, supporting you to support this baby. Hair growth is not a priority. It's not a priority for survival. It takes away nutrients and resources that you need elsewhere. And it's not actually keeping you warm. It's so not fair.
Sucks.
Big time. And so then you're doing what I suggest for people, obviously, is if you're taking a prenatal, obviously stay on your prenatal, get checked for these things, make sure you're not suddenly anemic, make sure B12 is not suddenly low, vitamin D is low, thyroid's off, because all of those will encourage hair loss. And then really love on the scalp. What products are you using on your scalp? Maybe now is the time you switch to more of a non-toxic shampoo, conditioner, dry shampoo, whatever you're using, product in your hair. Scalp massage can be really, really helpful. There are essential oils like rosemary or tea tree that can be stimulatory for the hair follicles. You just have to be careful because it is an oil, it's going on your skin, and it can go into the breast milk. And so just being mindful of that. So that's yes, I get the hair thing. It's terrible design flaw.
It's like, great, I just had a baby. I'm trying to figure out this whole body. I'm stressed out. And now my hair's falling out.
Right. And now what are these clumps that are coming out? Yeah. The technical term is telogen effluvium. And like I said, because hair doesn't serve a purpose, critical to life purpose.
Right.
But resources for growing a baby is important. That's where the body focuses.
So you mentioned a couple times about these nutrients and vitamins and stuff that we need, like things like B vitamins and vitamin D and iron and magnesium, all being really important. And that sometimes it's not even that we aren't maybe getting them from our food, but we're not absorbing it. So I'm assuming that this leads down to basically like a gut health issue, like having your digestion really on point. But is there anything like taking certain things together is going to make them absorb better, or you just have to take some probiotics, make sure your digestion's good, and then eat a whole foods healthy diet? Like, what can we say to people who are like, I feel like I'm eating healthy, but I'm still low in magnesium and vitamin D and these things?
So you actually might need a stool test. So you may actually have to poop in a cup for science. And so if you do have gas, bloating, constipation, diarrhea, you just can't get your nutrients up. Your practitioner keeps checking and they're like, oh, stay on it. You're not up yet. It's like vitamin D is a little different, but like some of the other ones, like B12 is a classic example. B12 does get absorbed in the intestines, and you may have something called intrinsic factor, where intrinsic factor helps to pull B12 in. But if you have antibodies against it, then you're going to struggle with any kind of B12 you eat, drink, or swallow, because you're just not going to be able to pull it in like you think you can. Some people are on heartburn medications. They're on proton pump inhibitors, and as a result, that's stopping them from absorbing. So they're eating super clean, but they still, for whatever reason, are having heartburn or GERD type issues and taking medication as a result. And then you may have stuff going on, growing, living in your intestines. You might have inflammation. You might have candida, you might have worms, God forbid, you may have some like creepy crawly things. It totally happens. Mm-hmm. We're human. It just, it's in our food. It sometimes gets in our water, animals, and they take up residence and then they stop absorption or they eat it themselves. And so, asking for GI help is okay. Just like asking for hormone help is okay. Like I feel gas and bloated all the time. Like help me with this.
And that's something that most people's like GP or like even, I don't know, whoever is helping you on a regular basis, your doctor, you should be able to ask, and they should at least be able to refer you out to somebody who can give you this like stool testing, right?
Yeah. So a lot of there's two types of stool testing. There's like conventional stool testing where they can check for ova and parasites. And then there's more of a functional stool testing, which is very multiple pages, more in depth, kind of like a Dutch test, but for stool and does maybe require more of a functional, integrative, holistic type practitioner. But your GP, let's say you've recognized or noticed or feel like gluten is a problem for you. You can get celiac tested. You can go ask your GP, like, what I'm noticing gluten, I think is a problem. Can I get celiac tested? That is a standard test that you can get. You may have to see a GI doctor. They may choose to scope you. You might have not irritable bowel disease. You may have, IBD, inflammatory bowel disease. So you may be experiencing a lot of significant GI things that you're blowing off to IBS, irritable bowel syndrome, or stress or whatever. But it turns out it might be Crohn's. It might be ulcerative colitis. Like it might be actually something much more significant, and you need to get that worked up. So totally start with your GP. A lot of this stuff, this initial screening things, they can do. And then beyond that, you may need somebody a little more or a lot more functional and integrative who are going to do these bigger stool tests for you.
Yeah. I'm taking notes here because I have I have some friends who have the like specific issues. And one of the things that's so tough, I think, with digestive health is that there are so many things that could be causing it. And there are so many symptoms. So it's incredibly difficult. Like I think everybody knows somebody who's had some kind of autoimmune issue or digestive issue that they're like, it took me years to get a diagnosis that was real, that actually helped, because it could just be anything, or people blow it off as being nothing. And it's so hard to figure out. So I understand why people get tired and overwhelmed, because even if you do advocate for yourself, it's like, how many more times do I have to ask the question, ask for help, try a different test? It can be very frustrating. So
it can be super frustrating, but it's your health. And so I'm always telling people, don't give up. You are your biggest advocate. It's not going to be your GP. It's not going to be your family doctor, your OBGYN. It's going to be you, because it's your body that you live in. So continue to advocate for it.
Yep, absolutely. Okay. Last kind of big topic. How a lot of people ask me this in kind of different ways, and I recognize that it's a very sort of vague question, but apparently it's on a lot of people's minds as they're in their sort of 40s, maybe early 50s, and they're used to being in really good health and being really aware of their body. And maybe they're starting to see some changes and starting to see like the big bad M word on the horizon. And they're like, how can I prepare myself and be proactive moving into a menopausal stage in my life? How can I minimize all of those symptoms we were saying at the beginning are like, oh, you're just going to be kind of miserable and sweaty and whatever. How can we be proactive about our health and our hormonal health moving into that stage of our life?
So all of the things that we have said up until this point, like the diet, the lifestyle, the chemicals, the not burning the candle at both ends, the sleep, et cetera, all applies 10x as you get into the perimenopausal stage. So all the things you thought you could get away with or half-ass in your 30s, you cannot get away with half-ass in your 40s and 50s. The body is transitioning. So perimenopause is the transitional state between a orchestrated roller coaster and the roller coaster is going off the rails before it flatlines, right? That's perimenopause. So it's 10 times harder when you're not sleeping. It's 10 times harder when you are not paying attention to what you're eating, what you're drinking, what you're putting on your body, the chemicals around you, the stress in your life. And it's hard. It's unfortunate. Again, terrible design flaw, because a lot of women are in their 40s. They're at the peak of their career, like they've got kids often. Maybe as they get their 40s into 50s, their parents are aging. So they're having to deal with that. Family matters. A lot of divorces in 40s and 50s in this transitional time. And so it's a lot. And it's me reminding women, I call it reverse puberty. We all knew what puberty was like going in. So sad, unfortunate. We have to back out of it. But you can't, I was going to say cheat, but cheat's not the right word. You have to really start putting yourself as a priority. We talk about it. We're like, oh, women just give, and women are the nurturers, and women put their families first. That's great. That's how, thank God for us. Cause otherwise families would probably not do well. And so, but now that you're in your 40s and 50s, now's the time you really do have to put yourself first, because you will slam into menopause as opposed to glide into menopause. And we all went to glide. Now, having said that, could you need supplements, hormones? 100%. You're about to lose a lot of hormones. So you might need some supplements, herbs and nutrients and stuff to carry you into it as your hormones are going down. And when you are fully menopausal, you may decide, you know what, my doctor and I've talked, and for risk benefit, I actually need to be on hormones for the quality of my life. That is totally fine. You still have to eat, sleep, hydrate, work on the stress, stop burning the candle at both ends, blah, blah, blah. In menopause, that's where I find that women tend to do the best.
Okay. So there's something about this flat line of hormones that sounds a little bit ominous, but it also could be sort of good, because once you reverse back out of that puberty stage, which sounds terrifying, but then when it's when you don't have to worry about this roller coaster anymore, that could potentially be a good thing, maybe, or not.
A lot of women love it. A lot of women love it, because now they're like, oh my gosh, I don't have a period, so I don't have to deal with that anymore. My migraines are gone, so I don't deal with that anymore. My mood is so much more stable, because even on the choreographed roller coaster, it's still an up and down. And for a lot of reasons, that can be very hard for women. It really can affect their mood, their depression, their anxiety, their anger, what have you. And so they're like, I feel way more stable because my hormones are very stable. And so, yeah, for a lot of women, and because it seems as women get older, their give a damn, goes away. And so they're like, I'm loving this new woman I am. I love the reverse puberty me. I know my boundaries. I'm outspoken. I am not afraid of my age. I feel better. I am who I am, and their confidence goes up. And I love that.
Yeah.
Now, is that every woman? No, but it's enough. It's a lot that I'm saying this, because I definitely have women that go, oh, I loved menopause. I love menopause. I love this new woman I'm turning into. And goodbye PMS, migraines, and fibroids. Screw you.
I see the potential there. I think some concerns though. And I look at I feel like when men hit a certain age, and this concept of testosterone replacement and hormone replacement therapy is a lot more, maybe, I don't know, well understood or out in the open. It seems almost, maybe just in the world that I live in, that it's quite accepted and normal and understood that a lot of men, as they're entering sort of their 40s and stuff, they may start with a doctor in a very intelligent way, start supplementing with testosterone to just kind of keep it at the levels they're used to or something. I don't know. So that they're feeling better in mood and sexual health and all these things. So, is there an element of that for women too? With the flatlining, with this bottoming out of the hormones, I know there's a transition period, but once that has transitioned, and if you are lucky enough to glide into that place, is that a potential concern too, where maybe the libido isn't where it was, or maybe the energy and the mood isn't. So then how do we even start that discussion about hormone replacement for women if they're worried about these things?
So there's a lot of shame I find in the female space around, you should be able to handle menopause. It's a natural transition. Every female has to go through it, no matter what. So suck it up, buttercup. Your mom did it, your sister did it, your aunt did it, generations before us did it. But the thing is once estrogen is very protective in the body. And while I don't think hormone replacement therapy is good for everybody, I don't give it out like candy. I do think because women live a long time, we're going to live probably about a third of our life in menopause. A third of our life in menopause. So why suffer? Why risk Alzheimer's, dementia, cardiovascular disease, osteoporosis, bone fractures, depression, anxiety, if that's a factor for you with estrogen? Estrogen plays a big role. There are other hormones, progesterone, testosterone, also very important for other reasons. But estrogen gets the bad rap because of a study called the WHI, the Women's Health Initiative, that came out. So prior to the WHI, women were given estrogen all the time, estrogen and progestin. Then the WHI study came out and said estrogen, it causes cancer. Hormones cause cancer. Get off hormones. And overnight, 90% of women went off their hormones. And it was a mess. And since that time, so many studies have come out to go, oops, that WHI trial was actually not that great. Like, there was a lot of coercion. There was a lot of back end nasty stuff that happened to get that trial published that have now come to light. So is estrogen perfect? Of course it's not perfect, but it's really pretty great for the right woman to help replenish her and hopefully protect against dementia, Alzheimer's, cardiovascular disease, et cetera, et cetera. Mm-hmm. In fact, there's a really great book. It's the average woman can read it. It's called The XX Brain. It's written by Dr. Mascani. Dr. Mascani is a female neuro researcher. She was like, nobody's studying the female brain. Let's study the female brain. And she's been talking a lot lately on Instagram about her recent publication of estrogen and estrogen's effect on the brain and dementia. And I don't want hormones to be shamed anymore as women go through menopause. If you go on hormones, good on you, because you're probably going to live a better, healthier outcome in your life. And you have to live in that for a third of your life, because we're just living so long. So when you say things like, well, you know, my great grandmother, like nobody's done hormones. They did up until the WHI trial. Wow. And then it got shut down. And so there's a lot of politics in hormones, and as with anything. Mm-hmm. And so, so if women need hormones, and not all hormones are the same. So if somebody says, well, I'm scared of hormones, I'm like, well, which one? Progesterone, testosterone, estrogen, thyroid is a hormone, right? We have a lot of hormones. And so it's being very specific, but it's working with a practitioner who understands hormones. Yeah. That's ultimately where it's at, because I don't want you to have no libido for a third of your life, right? Like, I don't want you to get early dementia in your 60s and 70s. Like, I don't want you to have bone fractures and osteoporosis, and now you're very frail and in a wheelchair. I don't want any of that for you. Yeah. So let's consider this. Yeah. Let's consider this.
So important. And I mean, the study thing is unfortunate for, again, like us lay people, everyday people who don't or can't read and really interpret studies and understand what's going on behind the scenes and all of the politics and all the special interests that go into, because we assume, we're like, if this is a scientific study or this is like in a journal or something, it must be legit, it must be authentic, it must be ethical, all of these things. And it just a lot of times isn't the case. And then people can go the other direction and like never trust anything ever again and never trust their doctors and think that people are out to get them. So it's like, it's a very fraught time, I think. But again, you know, what you said, which is just people, we've got to take kind of our health into our own hands to an extent. And by that, I mean, you know, empowering yourself to learn and research and ask questions and do the work of finding practitioners and people who will help you and who will listen to you and who are thoughtful. And if something doesn't feel right or someone's not treating you right, you can keep going and find somebody who will, because that's, I mean, it's important. Like you said, it's your health. It's like the most important thing.
100%. Yeah. 100%.
Nobody wants to not be horny for a third of their life.
I know. Exactly.
I mean, that's exactly. Well, thank you so much for taking the time. I really appreciate it. It's been lovely speaking with you. I hope we get to do it again. And again, I think that I'm learning so much from you too, because one of the things that I'm working on with a colleague of mine is this, it's a strength building program for women. So we want to gather women together and go through this training program to build muscle. And so many of the questions that I've asked you are questions that I come up against because I'm working with women who are in their, maybe 40s, maybe 50s, who have had a lot of different changes and things going on in their life. And they're really, maybe they're trying to do something different than they've always done before. And they're unsure, or maybe they're trying to keep doing the things they've always done that used to serve them, that no longer serve them. And so a lot of the psychology and the just trying to open your mind to a different way, sometimes a gentler way that we're not used to, it's really, really important. So talking to you, talking to people like you and having some of that validated, is very helpful for me, because I can be like, look, you don't have to take my word for it. Listen to the smart people. Listen to Dr. Jones. So anyway, thank you so much for your time. I appreciate you. And I hope we can do it again sometime soon.
Yes, absolutely. Thank you. And next time I'll have had my sauna so I can tell you all about it.
All right. Sounds good. Thank you.
All right, that's it. Thank you so much for listening. Couple more things about hormonal health I just want to add here at the end. If you are trying to work on reducing that toxic load, reducing the toxins that you come in contact with on a daily basis, because goodness knows we are all in contact with toxic stuff all day, every day, people, Instagram accounts, you name it. But if you want to reduce that, one of the best ways to do it is with better skincare, natural skincare. You know where I'm going with this. Primally Pure, one of my favorite partners, my absolute favorite skincare company. Their stuff is amazing. They use just a handful of natural ingredients that you can recognize and pronounce. Stuff like beef tallow, shea butter, essential oils. The stuff is luxurious. It's beautiful. It makes great gifts. They have baby stuff that I've been using on my own baby as well as myself. It's like luxurious high-end skincare, but without the price tag and without the sketchy ingredients. It's beautiful. Their natural deodorant is amazing. Their body butter is amazing. I can't speak highly enough about it. Head to primallypure.com and use the code MuscleMaven. You'll get a discount. You will not be disappointed. Also, if you want to know more about hormonal health stuff, check out my episodes with Dr. Ellie Michelle. She is another hormone-centric doctor who's fantastic. She and I actually put together a 3-day hormone workshop for women. This was about a year ago now, where we had live workshop classes about all the different sort of elements of understanding your hormones and sexual health and nutrition and working out and all the lifestyle factors that go into it. It was really, really cool. And we gathered all that information together and put it into a product that you can now purchase and access forever on your own time. So I'll put that in the show notes as well, so that you can check that out if you want to learn a little bit more about hormonal health. Okay, that's it. Thank you so much for supporting the show. I appreciate you guys, and hopefully I will see you here next week.